So the bulk of the patients I see come to my clinic complaining of back pain. At times, though, it's actually a buttock pain, and it's arising from the sacroiliac joint. We call it sacroiliitis. There's a lot of different reasons that cause it. Some people just have a leg length discrepancy where they're born one leg longer than the other. They may have had polio or some type of condition, but they're constantly irritating that joint. We see it in runners that repetitively that motion irritates that joint. We see it in some people that have a true inflammatory disease such as rheumatoid arthritis or especially ankylosing spondylitis. It's a true inflammatory disease. It really enjoys attacking that joint. Sometimes we see it in women have some pelvic pain after childbirth or any kind of pelvic trauma, even a fall. You can land and jolt that joint out of place. The way to diagnose this problem is we start with the examination, of course, but there's not a good imaging picture to truly identify that that's where your pain is coming from. X-ray is often unrevealing. Sometimes the MRI can show some inflammation in the joint. The best way to do it is to inject it, a very simple injection. We numb up that joint and you see if that's where your pain is coming from or not. We can also put some steroid in that joint and get that inflammation out of there. That injection itself will work best in conjunction with physical therapy to get those muscles and the motion return to your pelvis. And sometimes even chiropractic care can adjust that joint and get the motion moving in that joint again. Sometimes patients still have some pain or have a return of pain when they start to get back into their daily functions. We do have a new procedure called radiofrequency ablation. It's just a very special needle. The tip of it gets hot and it burns off the little pain nerves that are sensing that pain from the joint and relaying that pain message to the brain. So it's a good procedure for the right patient, and one of the best things is that it can provide pain relief from a year to 2 years. So it's a really good alternative, and it I've seen some good results where patients can get back in their job, get back in their life, even get back to running the things that they really enjoy.